What's happening, family? Dr. Joe here. Hope each of you are well and blessed. Got a great question. This comes from one of our private groups, so her name will remain anonymous. She writes, "Hello, Dr. Joe. I'm having a terrible time with my skin. I've been having these problems for about 7 months. I have terrible itching on the upper part of my torso. My doctor has really been dismissive about it. He actually said that maybe I should moisturize more. My response was there's no way I could moisturize any more than I do. Well, I found a new female doctor that I will be going to on Monday. Can you give me some suggestions of what kind of questions or tests that I can ask her about? I don't know if this will reach to you, but I just don't know what to do. I am," she leaves her age, which will remain anonymous. She gives her age, and I have never had this problem before now. All right, so salute to this person for submitting this question, and I'm going to answer it. But the answer to my question, to her question, is going to not necessarily be medically based, but this is how I view it, and what I would do. All right, a couple things I want to say, and I'll try to get to the point. The first thing that you need to understand, and those of you who may be dealing with skin issues, is most skin issues, things that you're experiencing, hives, psoriasis, eczema, itching, scratching, most of those, even acne, most of those conditions cannot be cured through the application of a moisturizer, a salve, a balm, or a serum. Most cannot. Now, there are things that can be done that can lessen the discomfort. If you have eczema and the skin is cracking and breaking, yes, to moisturize the area can help to reduce some of the inflammation, the cracking, and the discomfort. But it still doesn't get to the causation of the issue. The skin is an organ. It's the largest organ in the body. So most of the things are expressing themselves on the skin are coming, or the source is coming from somewhere on the inside of the body. And that needs to be addressed in order for this condition to be best handled. All right. So the second thing I want to talk about, what's going on now, when you're seeing issues where there's certain parts of your skin that you're seeing hives, breakouts, certain types of hyperpigmentation, discolorations, like she's talking about, especially breakouts in the upper torso. It's a specific part of the body. This is classic detoxification, that the body is trying to detoxify itself of or from something. If she was putting something on her body, or if it was environmental, i.e. perfumes, lotions, soaps, most times it's going to be throughout the entire body. It's not going to be in a localized place. But being that it's manifesting on the torso, and she's specific, she says the upper part of her torso, all right, and she gives a specific time, 7 months, basically tells me that something internal is going on, that she needs to find out what it is, what's going on, in order to rectify the problem. Now, most doctors are not going to give the instructions that I'm about to give, so it may be great for her to hear this, for you all to hear this, and you can work with your doctors in whatever way that you feel is best. Now, the third thing that needs to happen is there's something that this individual is ingesting, is something more than likely that's a part of her diet that is creating the body's need and desire to detoxify itself. And the expression of that detoxification is coming up in these breakouts on the upper torso, as she said. And the only way to get to the root cause of it is to participate in the elimination diet. This is something that, by and large, she's probably allergic to something, or she's having a food sensitivity to something. All right. If you're trying to find out what you're allergic to, an allergic test is going to be needed, because that's going to basically measure something that is occurring in the blood. However, a sensitivity test is something that is connected to what's going on in the gut. Now, an easy way to do it, if you can't get an allergy test, if you can't get a food sensitivity test, is to watch what it is that you eat. Watch what you eat and notice how you feel afterwards. Do you notice an increase of the symptoms? Do you notice discomfort in your digestive system? Do you notice gas? Do you notice bloating? Do you notice any kind of deviation in mood? Do you notice anything that is anything outside of normal? because this is how you pick up on what you need to take out. Now, getting an allergy test and getting a food sensitivity test is going to help you pinpoint what the issues are. And sometimes what you're allergic to and sometimes what you have a food sensitivity to can be natural foods. A lot of people think, well, I'm eating healthily. I'm eating apples. I'm eating oranges. I'm eating greens. I'm eating lean chicken, turkey. And sometimes those natural whole foods can be creating issues. I've talked about this innumerable times. My oldest and our oldest daughter, Skylar, when she was having issues with eczema, one of the triggers was avocado. One of the triggers was apples. When we removed that, it stopped and it gave us time to deal with systemic issues of her digestive issues as well as what was causing it. So this person needs to realize, and my best advice is to know that there's something that is causing it. You want to find it and you want to eliminate it. And the way you do it is you want to first know what is causing my issues and you want to remove it slowly. And then once the symptoms stop or cease, bingo. You're not going to need any more salves, balms. You're not going to need any more ointments. Now, the fourth and final thing is, as you're doing this, it's important that you back off of some of the medications that your dermatologist may give you. Things like steroids, things like anti-itch creams. It may be antihistamines that you're giving. Things that are lessening the body's reaction. You want to know how the body's reacting. You want the body to produce the histamine. You want the body not to be exposed to steroids, to deflame it. Because if you are trying to identify what's causing the problems while being medicated, you're not going to see it, if that makes sense. If I've got an antihistamine and I'm exposing myself to something that I'm allergic to, the body is going to naturally produce histamine. So I don't want to be on the histamine while I'm trying to figure out the elimination part of the diet, if that makes sense. Now, all of what I'm telling you goes against what most dermatologists are going to tell you. You want to keep this in mind. I don't think you should go into your doctor's office telling them that Dr. Joe said this, because they don't care who Dr. Joe is and what I have to say. And you know what? That's all good, because they're in their lane. They've gone to medical school. They are trained to do a specific task. But most of those individuals are going to prescribe you medications, ointments, creams, something that you've got to go to a pharmacist to get. It's just the nature of how Western medicine is practiced. So the best thing that you can do is to take what I'm saying into consideration, still go to this new doctor, get all of the information from your new doctor, get all of what it is that she can help you with, take what I'm saying into consideration and make application and do what's best for you. That's what I recommend. I hope this helps. Until next time, be well and be blessed. And I hope you can nip this in the bud. Skin issues can be quite annoying, but I promise you, I'm 99% sure that what you are noticing is something in your diet. And once you are able to identify it, remove it, and you can probably be in a better place. I still would not rule out perfumes if you've changed, new soaps, new fragrances. Of course, you want to take that into consideration. But being that it's localized on your torso, it's probably something that you are ingesting and the body is trying to detox itself. And what you're seeing are the expressions of how that detoxification is coming up to the surface of the skin. Until next time, be well, be blessed. We'll see you on the next one. Peace.